to the last talk of this section that is being given by Dr. Maha Tawfik, Immunohistochemical Tissue Expression of Mortalin in Vitiligo Patients. Please. Yes, that was the wrong presentation. Yeah.
Okay. I'm so proud to be here with you in the Vitiligo International Symposium to present an abstract on immunohistochemical expression of Mortalin in vitiligo patients. Vitiligo is the most common depigmenting skin disease which progressively destroys skin-resident melanocytes. No single cause for vitiligo has been identified, though many factors are implicated, such as genetics, stress, metabolic alteration, oxidative imbalance, and autoimmunity, referred to as the convergence theory. Mortalin is a member of the heat shock protein 70 family, which has different functions, including mitochondrial homeostasis, protein folding, oxidative stress regulatory function, intracellular transport, chaperonization, cellular proliferation, and protection against apoptosis. Mortalin expression was found to be elevated in many human tumors, for example, brain, colon, breast cancers, and leukemias, among others. Owing to its anti-apoptotic function, targeting Mortalin was supposed to help inducing growth arrest in tumor cells. Various studies have already confirmed this suggestion. Melanogenesis is a well-established stress response. In 2016, and for the first time, Wadwa et al. Showed the relation between Mortalin and melanogenesis, where Mortalin expression was upregulated together with melanin in response to stress caused by ultraviolet rays and hydrogen peroxide. And this was followed by another study on the same point in 2019. Consistent with these findings, Lee et al. Conducted a study on keloids, which showed that knockdown of Mortalin caused depigmentation. So, the main objectives of the study was to identify Mortalin immunohistochemical expression in vitiligo patient skin in comparison to control group, and to determine the correlation between Mortalin immunohistochemical expression and vitiligo clinical pattern, disease activity, and severity. As for the subjects and methods, a case control study was conducted at dermatology clinics, Suez Canal University hospitals in Ismailia, during the period from May 2019 to May 2021. 40 non-segmental vitiligo patients and 40 matched controls were enrolled in this study. Full medical history was taken from vitiligo patients. Total body skin examination was also performed to assess vitiligo clinical pattern and clinical signs of activity. Standardized clinical photographs were taken to evaluate vitiligo extent score via the vitiligo calculator. Vitiligo disease activity was assessed using the VIRA score on a 6-point scale. 2 4-millimeter punch biopsies were taken from each case. One biopsy was taken from the margin of the representative lesion, totally inside the macule or the patch. The other biopsy was taken from the perilesional area of normally pigmented skin within 2 centimeters around the most recent vitelliginous lesion. Tissue expression of Mortalin was assessed using immunohistochemical technique in lesional, perilesional skin, and healthy control skin using Mortalin antibody kits from Novus Biological Europe. Immunohistochemistry slides were first read through the light microscope by an expert pathologist and the main researcher, and images were taken through the microscope. Then quantitative analysis of immunohistochemical expression of Mortalin was done by analyzing captured images from the light microscope via an image analyzing software for evaluating indices of positivity on immunohistochemistry slides. That was expressed as a percentage of the area stained. As for the results, study subjects included 40 non-segmental vitiligo patients and 40 matched controls with a mean age of 32.4 years. 23 patients had vitiligo vulgaris, comprising 57.5% of the sample. 9 patients had acral vitiligo, and 8 patients had focal vitiligo. As for the VIDA score, 12 patients had a VIDA score of +4, comprising 30% of our cases, and the least VIDA score achieved was 0 in 5 patients. As for the vitiligo extent score, it ranged from 0.14 to 42.86, with a mean of 9.91, with a mean of 9.19, plus or minus 9.64. As for the immunohistochemistry, the level of expression of Mortalin expressed as the percentage of the area stain among lesional, perilesional, and controlled skin groups. The lesional skin group showed the most highest expression of Mortalin, with a mean of 10.96 plus or minus 4.9, followed by the perilesional skin group showing a mean of 6.49 plus or minus 3.7, and the least expression was shown in the control skin group with a mean of 3.25 plus or minus 1.35. There was a statistically significant difference between each two of these three groups, where the p-value showed to be less than 0.001 in each of these sets. As for the expression of Mortalin in the lesional skin, it showed to be significantly correlated and inversely proportional to the VIDA score with a p-value of 0.019. And it also showed to be significantly correlated and inversely proportional to the VISA score with a p-value of 0.026. However, in perilesional skin biopsies, tissue expression of Mortalin showed no significant relation to the VISA score or the VIDA score, and it was found that Mortalin tissue expression in lesional and perilesional skin biopsies showed no significant relation to the clinical pattern. So to conclude, study results indicated a possible relation between Mortalin and melanocyte loss in vitiligo. The results support the role of Mortalin in pathogenesis of vitiligo owing to its stress regulatory action and its role in inducing melanogenesis. So our take-home message, that Mortalin is a stress regulatory protein that has been identified recently as having a role in melanogenesis. Its role in different pigmentary disorders has not been investigated yet. So we recommend further level assessment, either in skin or in serum in vitiligo patients, to reveal the underlying role of Mortalin in the pathogenesis of vitiligo, after which hopefully it can be potentially targeted and induced to inhibit melanocyte loss and support repigmentation in vitiligo. These are my references, and special thanks to my supervisors in the Faculty of Medicine, Suez Canyon University, and thank you so much.
Thank you very much for this talk, and even to present us this Mortalin. No, I didn't know nothing about this type of protein and its possible role in control of the melanogenesis. So we learned something new. Comments, questions? No? So probably the novelty of these proteins has not raised some questions. Thank you very much for your talk.